I'm Liz Feldman. I'm with Livelihood Northwest. And today we are very excited to host a presentation by Shauna from the Small Business Legal Clinic on reopening and updated legal considerations. Livelihood Northwest provides technical assistance and consulting to underserved local small businesses. You can always check us out on our website. But right now I would like to pass this over to Juliana with the Lewis and Clark Small Business Legal Clinic so she can say a little bit about what they do, and then Shauna will present. So welcome and enjoy the presentation.
Thank you, Liz. So my name is Juliana Elligan, and I'm the director of the Small Business Legal Clinic. I think many of you have already worked with us before in the past. So we are connected to Lewis and Clark Law School, and we provide low-cost legal services, transactional legal services to low and moderate income small business owners. We work in a variety of areas. We focus on issues like registering businesses, drafting contracts, helping with intellectual property questions, employment law questions, and what we've been doing a lot lately, which is helping businesses understand about regulations. Now is a time of pretty dense and ever-changing regulations, and so we're really excited to be able to provide a series on these regulations as they roll out and as they change and as people are trying to interpret them as we go from one phase to another. So we definitely would look forward to continuing a conversation if you're looking for more one-on-one help. The presentation today will be just general information, and if you're interested in understanding how that would apply, or if your particular plans are going to work within those regulations, definitely connect with us and see if we're able to, we can help you and bring you through. All right, so I'm going to go ahead and introduce Shauna. She's the brains behind this presentation, and she will, we're hoping to have more of a conversational style today. We'll do the initial presentation and then have lots of time for questions and answers. All right, thanks, Shauna.
All right, thank you so much, Juliana, and thank you everyone for taking the time to attend this morning. So initially, I had called this presentation, Now What? This presentation is meant to be a continuation of our earlier presentations that we did mid-May, talking about reopening your business space and what you should do as an employer during the time of the coronavirus pandemic. So this presentation is meant to be a takeoff of those presentations, giving you an update of what has changed in the last month. So we do have links on our website. If you want to see some of the earlier presentations, Juliana will put the link up in the chat box for you guys. But otherwise, I'll go ahead and just get started. So this presentation is about reopening and the updated legal considerations that you need to take into account. I am Shauna Knight, a staff attorney with a Small Business Legal Clinic, and I just want to give people a reminder that this presentation is for informational purposes only, but please feel free to reach out to us with questions, to do one-on-one consultations and things like that, and I can also answer general questions after the presentation. So, kind of a follow-up. Where can you find this stuff? This information is changing all of the time. Just this morning, I had to update this presentation with new information on the mask guidance. We'll talk a little bit more about that later. But one thing that's really nice is a lot of the government websites have prettied up their links, so they're a lot shorter and easier now. These links, you can click on them when the presentation is posted on our website. But for now, I would probably say that if you're trying to keep up with this and you're a really busy small business owner, I understand that you probably can't spend 4 hours a day on this every day. So I would say that probably the best sites here in Oregon, first and foremost, are Governor Brown's resources site, and that's coronavirus.oregon.gov. I'm going to be referring to it a lot during this presentation. It's where you can find out what status the county's in. It's where you can see links to the governor's executive orders. It's where you can see all the phase 1 and phase 2 guidance. It's where you can get links to resources, whether those are grants or whether that's help from OSHA. We'll also talk a little bit more about that. Also, I'd really strongly recommend keeping an eye on your local news. They oftentimes post updates before the government updates their website. So sometimes they're kind of, rather than having to monitor the federal and state sites all the time, keeping an eye on your local news might not be a bad idea, whether that's through social media, whether that's going directly to their sites, but just to see what is going on with the new updates. Some other really helpful sites I'll probably refer to throughout this presentation are going to be the CDC. The second one down there under the other really helpful ones is the Equal Employment Opportunity Commission. This is especially important for employers. Also really important is the Federal Occupational Health and Safety site, or OSHA. They actually have a lot more guidance than Oregon as a state does. So if you're not seeing guidance for your business or your industry on the Oregon website, there might be additional guidance available on OSHA and CDC. I also am going to talk a little bit more later about Oregon OSHA resources, and they have a lot of good links. They have frequently asked questions. They also deal a lot with essential businesses, so businesses that would be open, regardless of where the phases are, such as construction and agriculture and things like that. Those are really good sites to pay attention to. So you're probably wondering, what's new with the phases? So currently, just right now, as of today, all the counties are at least in phase 1. Many are in phase 2, but if you've been watching the news and seeing our numbers really steadily increase, keep in mind that this is a do-si-do. We are probably going to pause, step back, and we might reevaluate, and the phases might be redefined as we go. So this is an update on where we are now, but it's a good idea to stay up to date with your news and the coronavirus.oregon.gov page to see where things are going, especially as coronavirus infections rise. And one thing to kind of keep in mind too is that a lot of the things that the reasons behind the closure may not have anything to do with what you're doing. We can do our very best to protect each other and be very careful. But for example, right now, one of the biggest sources, according to the Oregon Health Authority, for the increases are community gatherings. So like people having folks over into their backyard for a barbecue, which may really happen this upcoming weekend with the 4th of July. So those are just things to kind of keep in mind. Also, since we last talked together, the state has issued a ton more guidance on all kinds of things that aren't connected to the phases, including face coverings, which we're going to talk a little bit more about in a second, outdoor recreation, so like the opening of parks or closure of parks, employer guidance, childcare guidance, summer school guidance. All of this other guidance is sort of outside of the phases, but it's important to keep an eye out. Another thing that's new with the phases, especially for those of you in Multnomah County, if you were last looking at the phase guidance in May, I would point out that the governor has updated all of the phase guidance on June 11th. Not a lot of things substantively changed, but they took a lot of questions, so they clarified things, they narrowed it down, they made things shorter. So if you haven't visited that guidance since June 11th, I would recommend that you go back and take a look at the guidance that impacts you. Another thing you're probably going to notice is that the guidance doesn't cover everyone. Like there's no guidance in phase 2, for example, for offices, which may, but are recommended not to reopen under phase 2. And what we're finding is we're actually having to look at several different kinds of guidance to try to figure out where some businesses sit. For example, a dance school might operate under some of the guidance for venues and also for maybe some sports, but also maybe for under summer school as well. So you might be looking at a couple of different pairs of sector guidance to kind of figure out where you land. There's nicely and helpfully now frequently asked questions for all the phase 1 sectors. And we finally got some phase 2 guidance, and they're working on getting frequently asked questions out for all of the phase 2 sectors. These frequently asked questions are really helpful. I really recommend that you keep submitting questions to OSHA and to Oregon Health Authority and any of the folks that you're in contact with, because this really helps us clarify the guidance, get some more certainty and feel a lot more comfortable with where you decide whether you open your business all the way, partially, decide to stay closed with some things, or how you decide to move forward. So phase 2, we finally have some guidance. There's several counties that are in phase 2. Multnomah County is not in phase 2. And in fact, the governor's office has linked Multnomah County, Washington County, and Clackamas County together for the purposes of moving forward into phase 2. So the other counties cannot currently move forward into phase 2 unless Multnomah County can also move into phase 2. Part of the reasoning given for that is because, people live in one county, commute to another county, work in another county, or people are just driving to another county because they wanted, to go out to eat, for example. And so the governor and the Oregon Health Authority and others came together and said, we're going to link these together. The numbers in all 3 counties are pretty high. And I know one of the counties, although unfortunately I can't remember off the top of my head, but one of the counties has asked to be unlinked. However, that county continues to have high cases of coronavirus. So it's really not clear that they're going to get that okay unless they can bring their numbers down. So things to know in phase 2, which we're not in yet if you're here in Multnomah County like I am, but if you are in phase 2, or you're kind of looking forward to how things might go in phase 2 once your county gets approval, know that restaurants and bars can stay open till midnight. They can do partitions. Some offices can reopen, but they're really strongly encouraged not to. Swimming pools and sports court are being reopened. A really clear thing you can probably see throughout this is, stay far away from each other, wear a face covering, don't make sure you're cleaning and disinfecting things. Indoor and outdoor entertainment like bowling alleys and arcades are going to be able to reopen limited. Everyone's reopening on a limited basis based on how they carry out their physical distancing. And some things aren't being reopened. For example, if there was a gym that had childcare, they're not currently able to reopen their childcare. There's also guidance for outdoor recreation and recreational sports and venues. Same as usual, but there's also some other things you should know, like if you're going to, an outdoor space is becoming more and more important to everyone, including small businesses. If you're say, for example, you're a business that might provide something like kayaking tours or things like that, different things to know. The government has issued special guidance on gatherings in phase 2 that are helpful to know for all of us, including that they're acknowledging that anything outdoors is going to be safer than anything indoors. Keeping in mind that, having the open air and having that circulation is safer. So if you're a restaurant, you're maybe thinking of only opening outdoor seating. They're also, issuing guidance to be really careful about HVAC systems. So if you're indoor only, like an office, and you just have the air circulating, even if you are maintaining the 6 feet distance and wearing your face covering, there's studies that are coming out that show that the HVAC systems can circulate. There was a study that came out of China a couple of weeks ago, and there was a man who was infected with coronavirus, and he stayed far away from everyone, but there were still people who were way further away than 6 feet who became infected, and they're blaming the HVAC system. So that's something that can be helpful to all of us wherever our phases are in helping with your planning. Gatherings in phase 2, they've expanded to 50 indoors and 100 outdoors, but only if you can maintain that physical distancing. Employees still have to wear masks, and depending on what county you are, customers will have to wear masks, but everyone is encouraged to. There's a couple of different sectors, including really large spaces for indoor, outdoor entertainment, restaurants and bars, and venues that can allow up to 250 people. But you want to be careful and read that guidance if you're looking at, especially if maybe you are a venue or an event planner. You want to be really careful with that to make sure that you're following the law, but you're also limiting your liability and being careful. So I promised that we were going to talk some more about the masks. Probably you've heard, but maybe you haven't, that that there's a new requirement for several counties for customers, not just employees and not just businesses, to wear masks. So the Oregon, I want to clarify, there's been a little confusion about this. The Oregon Health Authority's sector guidance is still in place. Phase 1 and Phase 2 businesses, they still have to require employees to wear masks, with exceptions for people with disabilities or trouble breathing when they wear the mask, and they have to provide those masks. So really take a look at your sector guidance to see what the requirements are. The new mask guidance isn't out there necessarily for small businesses. It's out there for our customers. So looking to the right side of the screen, for now, at least the most populous 7 counties, that includes Multnomah County, that includes Hood River. I've got another slide on this in a second with all of the different counties it applies, but they must wear masks. The mask requirements under the new rule require that every customer wear masks unless they're under 12 years old or they have like a health disability or trouble breathing. We'll talk about that in a second because I have a scenario about this because it's caused a lot of confusion. You can add further restrictions, like say, for example, the CDC only says that children under 2 can't wear masks because it's just not safe for them to do so. So you could say, for example, as a business, you can say everyone over the age of 3 has to wear a mask unless you have a disability. If someone is not wearing a mask, you have the right to ask them if they're not wearing a mask because of a medical condition or disability, and they can say yes. You don't have to require proof, and actually you can't ask what that disability is. So unfortunately, a lot of this enforcement is falling on business owners and employees, which isn't necessarily fair. If you want to take a look at what might happen with this, it's fair to look at what other states, especially states that Oregon has been working with on their reopening, like Washington and California. In California, they're requiring masks for everyone in indoor and outdoor spaces. Currently, the requirements for the masks here in these different counties are only for indoor public spaces. Here's a list of the counties: Multnomah, Washington, Clackamas, Hood River, Marion, Polk, and Lincoln. And you'll notice, I just updated this slide this morning, that Clatsop County has been added to the list effective this Wednesday, July 1st. So a part of the mask guidance is that if any county wants to, they can opt into this requirement. So if this is something that you're really concerned about and you would like to see your county, if you're not in one of these counties, enact this, you can reach out to your county representatives and ask them if you can opt in. So this flyer is really readily available on the coronavirus.oregon.gov site. You can print it out and post it yourself just to give folks reminders. On the one nice hand, it changes having mask requirements from customers in these counties from being an employer responsibility to like, sorry, everyone's got to do this. It's not me being mean to you or, this being hurtful to you. However, this isn't an easy answer. Unlike in Washington, Oregon has really opted not to enforce this. They're saying that they're not planning on walking around and issuing fines to people, although Governor Brown has said that the mask ordinance is enforceable. I think they're planning to really try to focus on education and kind of convincing people that this is the right thing to do. If you want to be able to shop at your favorite small businesses, then you have to do your part to minimize the coronavirus transmissions. And part of that is wearing a mask. So kind of looking at it is more of a civic duty to protect vulnerable people so that our small businesses can stay open. But on the other hand, it makes it really difficult for you. So with that, I'll move into a scenario on this, which won't answer every question, but I think maybe we'll get to the heart of some of the biggest ones. So say, for example, we have Sidel, who owns a salon that just reopened during phase 2 in Multnomah County. And she's been very careful to follow the personal service sector guidance from the Oregon Health Authority. She's asking screening questions for COVID-19 symptoms. She's recording client contact information as required by the guidance for her sector. She's making sure she's removing magazines, and she's requiring appointments and even following the recommendations to purchase medical grade masks for herself using the OSHA supply connector. She also requires her customers to wear face coverings and is relieved that it's now mandated by the governor. So it's not just her business's requirement. However, with everything that's going on and all the information out there and some customers being upset about this, what on earth is she going to do if someone shows up without a mask? So here's a little help on what to do. So as I mentioned earlier, you are allowed to ask someone if they're not wearing a mask because of a medical condition or disability. They can say yes, and you can't ask what disability. So especially with personal service providers, you know, we have to make reasonable accommodations for people with disabilities, but risking your health to the coronavirus is not a reasonable accommodation. So depending on Sidel's level of comfort, after they say yes, she can let them in, or she can offer a reasonable accommodation. So maybe, for example, she's purchased face shields that she disinfects and allows customers to use, or maybe she has a face shield that she can use. For example, in some of the frequently asked questions for personal sector guidance, like say, for example, if someone was giving someone like a face trim, like a trim of their beard, for example, they're obviously not going to be able to wear a mask for that. So the frequently asked questions has said that the personal service provider can have the person take off the mask, but they need to have a face shield in place when they're doing that to be protective. But you know, this helps maybe Sidel, but what about if you have a shop that's open? Well, if you have a shop that's open and someone you know, has a medical condition or disability and can't wear a mask, and you don't want to endanger yourself, you can say, for example, offer accommodations like, you know, may I shop for you and bring things out for you? Or we have an online shop so that you can shop and then we can either deliver things or you can pick them up on curbside. One thing that I would recommend though is if you are planning out, you know, what if this happens? What if X happens? That you maybe put this in your policies and share them with your customers ahead of time. So that way they know that this is a rule that's being applied to everyone, that it's not going to be just them. It's less likely that they'll get their feelings hurt or even worse, get violent or aggressive about it. If you ask them this question about whether or not they're wearing a mask because of a medical condition or disability and they say no, you can remind them, point to the signs about you know, the law or policy. You can ask them to come back without a mask. Some businesses offer disposable masks to customers to use in their stores or place of business. Some people are offering masks for sale. If they have an appointment and like your door's locked and they show up with no mask and you have your, you know, you talk and they say, no, I don't want to wear a mask, you know, you don't have to unlock the door and let them in. I really like the sign on the slide, you know, no shirt, no shoes, no mask, no service. I think that this is really helpful too, in addition to the Oregon Health Authority guidance or their signs, because it's really normal. Like for as long as I remember, I've seen these signs. I've seen signs where if people show up without, you know, a shirt or shoes, they're not going to get any service. I've also seen those signs about telling people to be nice or leave. You have a right to say to not give service to people, especially if they're in violation of the law. But there's also this really practical issue of like, what if someone turns violent or aggressive? So sending out policies ahead of time can help prevent people from getting angry and help set people's expectations. But you can also look at other preventive measures. For example, you know, if you're a professional service or personal service provider, you're only doing appointments. But maybe if you're a store or a restaurant, you're only taking reservations and you have the ability not to let people in. Also, if you have a situation where Maybe you have a restaurant or a shop. Like, do you have shopping opportunities that are only outside? That really reduces the risk of transmission as far as we know based on the science we have right now. So that could make things a lot easier. It's still a good idea for people to wear masks. But if they can't come inside your place of business, that provides some protection. If you have someone who's already in your space and they're being violent and aggressive, get yourself to safety. You also have the option of contacting the police. You can tell them to leave. If they don't leave, they're trespassing. So even though Governor Brown made it seem unlikely that the police are going to be issuing fines or making any kinds of arrests for people who aren't wearing masks when they're supposed to, if someone is acting violent or aggressive, if they've assaulted you or they've broken your property, that's a crime. If they're on your property and they won't leave, that's trespass. You can have them be removed for that reason. And keep in mind that you are not less valuable than your inventory. This might be a good time if you don't have insurance to think about insurance and what kind of insurance you would like to have. But if you have employees, your employees are the most important things here. So there's things you can do to prevent, but when it happens, make sure that you really think of safety first, because you are really what's really important here. So on a complete change with absolutely no segue from me, I wanted to also give you an update on what's new from OSHA. And look, I spelled OSHA wrong. I'm sorry about that. I will get that fixed before we put the slides up on our website. So from OSHA, I know that during our last presentation together, we were talking about record keeping. No one had said anything about record keeping up to that point, but now we have information about record keeping. So according to OSHA, COVID-19 is a recordable illness if it's been confirmed. So, maybe they went to the doctor's office and they have a positive test and it's work related. So if someone comes into, your place of business, an employee, after, the 4th of July, like within the next 2 weeks after 4th of July, you ask them questions about, do you have a cough or do you have a fever or anything like that? And they have it and it's not work related, but maybe just something that they caught from attending a backyard barbecue. This isn't something that you have to record. There's also exceptions under OSHA for employers who have less than 10 employees for recording. I think it's a good idea, though, to make sure that you keep this information confidential. This would be confidential medical information, and that you also consider, any information that if you do have someone who is sick and you have to immediately send them home, you might want to consider, recording what happened that day and any information you think might be helpful for contact tracers. If someone gets sick and it is work related, then that's something that you definitely want to record. And that doesn't necessarily mean that you're admitting that you're at fault or anything, but just saying, here are our policies, here are the things that we did to be careful. Unfortunately, it's still still 2 people got sick. This is the dates that we realized people were sick, and this is what we did to follow up. And this will help with record keeping, and also if there's any OSHA investigation or issues with that, you can share that information with them. So according to the Equal Employment Opportunity Commission, so the EEOC, so this information may be a little bit more helpful for employers, but also maybe also for personal service providers who are doing temperature checks as a part of allowing customers into their space. So the Equal Employment Opportunities Commission no longer considers taking someone's temperature a medical procedure under the American with Disabilities Act. However, you might want to reconsider whether or not you really want to do temperature checks. I'm going to talk a little bit more about this in a second, but keep in mind that the CDC has said that not everyone with COVID-19 has a fever, And also, if you have to take someone's temperature check, say maybe with one of those little infrared little devices that scans your forehead, you're probably having to get within 6 feet of them. So if you're doing that, you probably want to have something better than, a cloth face covering that, you purchased from like a clothing provider. You're probably going to have some kind of medical mask or face shield for protection, because you are going to be getting closer than 6 feet in order to scan someone's forehead. Also, OSHA has been partnering with the CDC to provide sector guidance for like the meat and poultry processing industries. So if you're in any way connected with that, like maybe through agriculture, that's something important to keep in mind. I think they really wanted to address that, especially since some of the bigger spikes of COVID-19 infections across the country have happened in food processing facilities. OSHA also, not this last Friday, but the previous Friday, actually issued its own reopening advice and guidance to employers. It's like a 27-page document. It's linked here, and you're welcome to read it. But it definitely seemed to me to be more directed towards people working in offices. So maybe skim it, see if it applies, see if it's helpful. The OSHA guidance is not necessarily going to override the guidance from the state. It's very permissive. So it's not like you have to do this, but you should consider this. Whereas some of the state guidance is you have to do this in order to legally open. So the OSHA guidance says use this with state guidance, but then they also created 3 phases to reopening. They generally say they really want people to be teleworking all the way up until there's a treatment for COVID-19. They really push teleworking. They really push only having the number of people inside the office that absolutely have to be there. And of course, maintaining that 6 feet of physical distancing. A nice thing that OSHA did though, is they did suggest more accommodations for workers who are at higher risk, or maybe they have household members who are at higher risk, or they're taking care of someone who's at higher risk, like a relative who, maybe has, diabetes, or has had lung cancer or something like that. They really are suggesting people to be more careful with that. However, making an accommodation available to someone is not the same thing as saying that we're only bringing back workers who don't have these higher risks. So you want to be really careful. The Equal Employment Opportunities Commission has said you can't make people stay home who are higher risk. So I'll talk a little bit more about that with a scenario, but you want to be really careful. There's one thing is offering accommodations, and there's another thing is saying only healthy people with low risk can come back. So the first one, offering accommodations for people to choose for themselves, is permissive, it's allowed, but only bringing back certain employees who you think are lower risk could be discrimination. So you want to be really careful with that. So these phases are pretty vague, they're pretty general. They do really, I think they talk more to people who are in office settings, but here's a link. It might be worth a look. It might be helpful for you in forming your policies or your picture about, what happens if you reopen more, what happens if the governor, decides to stop and go back to an earlier phase. This can maybe help inform some of that discussion in your policies for you. So I wanted to throw in another scenario regarding testing and screening, because this is another important update that's come out. So I have Maria, who owns a flower and design shop. Sorry for the spelling error there. I'll fix that too. She owns a flower and design shop, and she has 2 employees. She saw that the new guidance for employers for the OHA, that's the state guidance, suggests that employees get screened for coronavirus symptoms. She didn't see any such requirements for retail stores though. So it's only the employer guidance, but not the retail store guidance. So she's wondering, okay, so what kind of questions should I ask employees? And should I take their temperatures? Do I have to record the results? And here's kind of some things that Maria can take into account and do. So I actually gave Oregon OSHA a call, and I'm going to talk more about this. I know I keep saying that, but they're really wonderful. And they told me that you should follow the OHA guidance for what you must do. So currently right now, neither employers nor retailers have to screen. The only sector that has to screen and ask those screening questions are personal service providers. And they're only told that they have to ask certain questions like, do you have a cough? Do you have a fever? And then personal service providers are recommended to do temperatures, but I'm wondering if they're maybe going to walk back on that advice based on some of the information I got from OSHA. So the questions that the OHA guidance tells personal service providers they have to ask is, do you have a new or worsening cough? Do you have a fever? Do you have shortness of breath? Or have you had close contact with anyone with these symptoms in the last 2 weeks? This is a really limited list of what we know of coronavirus symptoms right now. Not everyone has all the symptoms, and some people actually don't have any symptoms and they're still sharing the virus with others. The authority for all of the COVID-19 symptoms is cdc.gov. Business owners and employers especially are recommended to be familiar with that list, so that way you can ask your questions if you do decide to ask questions accordingly. So temperatures, remember I said that the Equal Employment Opportunity Commission says that taking someone's temperature is not going to be considered a medical procedure during the COVID-19 pandemic. So you shouldn't be taking temperatures for any other reason, but just for making sure that people are okay coming into, your office space or your building space or your event space. But, take this with a grain of salt. Do you really want to be taking people's temperatures and wearing a medical grade face mask if not everyone, has a fever? Both OSHA and the EEOC have warned about this. The CDC has also warned about this. And then, you'll have also additional operating costs if you're having to purchase medical grade masks. Also, something brand new that wasn't available the last time we talked was that employers can now require COVID-19 tests of employees, not customers, before they return to work. However, be really careful about this. You're going to want to consider what your policy is on this. Are you paying for the COVID-19 tests? Are you only having people take the test if they've been exposed? Are you having everyone take the test? Make sure you're not discriminating is defeating the virus without creating any antibodies. So you can't require any antibody tests. You can't suggest that they have to take those tests, but you can require COVID-19 tests as long as you're requiring it either across the board or in very specific circumstances. So I wanted to take a little bit of a tangent for a second with you. I wanted to point out that Oregon OSHA has a lot of free resources for small businesses, including free consultations. So Oregon OSHA is offering tons of free help. They're so nice. I called them really upset, trying to figure out a question for you guys, and there's no guidance anywhere because there's just not enough guidance for every single thing that could happen. And they really carefully walked me through, let's look at the sector guidance, let's look at this guidance, what do you have to do, whereas what are you allowed to do, and should you really do it even though you're allowed to do it? I called them and, I had to leave my name and number, but they called me back pretty quickly. And then the person I talked to didn't have all of the answers. So she took my email address down and she did some extra research for me and got back to me on CDC issues. So very, very nice. Some businesses are more risky than others, and you might have seen in some of my previous reopening presentations that you should do a risk assessment. OSHA can do the risk assessment for you. They can help you with the risk assessment. They can help you find supplies if you need specific supplies. They can give you and your employees training. If you write up policies and you're not sure that they comply and they're as protective as they can be, or that they don't violate any other issues, they will actually review your policies for you. So this slide is up here. There's several phone numbers, but also you can go to the Oregon OSHA website and find this information as well. But they're really nice and I really recommend them. And I also noticed that some attorneys are offering these services at a cost and at attorney fee level costs. So if you're going to a private attorney for something like this, you know, even if I had someone come into my office and we did policies together for their business, I would probably still call Oregon OSHA up and say, hey, can you walk through some of these with us to make sure we're on the right page? So it's totally free. It's just a great resource, and there's really no reason you shouldn't be using them. I think we all could use all the help that we can get. So thank you for following me with that on that tangent. So I did want to throw in another scenario. Maybe this is a little bit more for folks who are employers, but I think it's also kind of just good to know that this is out there. So I'm going to return back to Maria's flower shop. And remember how I said she had 2 employees? Well, in this scenario, one of them is over 60, and Maria also knows that she has some health conditions that this employee is worried about. So Maria is very worried about this employee, but doesn't want to accidentally commit any discrimination. She's wondering if OSHA's new employer guidance, which says to offer accommodations to at-risk workers, means it's okay to tell this one employee that she can stay home. And just to kind of reiterate, I want to say be very, very careful with this one. You want to follow the EEOC guidance with the OSHA guidance. So if you read them together, the EEOC says, you know, telling an employee they have to stay home, just because of their age or medical conditions would be discrimination. And you want to treat your employees the same. But you definitely can make a reasonable accommodation if an employee asks you. You could also provide everyone at your business with information and give them the opportunity, hey, if you have questions or concerns or need an accommodation, please come to me and tell me and we can talk about it. So an example on what to do is Maria could tell all of her employees that she's reopening her shop, or maybe reopening it more or less. Maybe she's going to have only outside stuff open. Maybe she's going to open the entire shop. Maybe she's only doing delivery. But whatever stage she is, she can say, I want to be able to accommodate employees who may be at increased risk or caring for someone who's at increased risk. So if you'd like to talk about an accommodation, please let me know and we can discuss it privately. And the privately part is just to, you know, make sure we're protecting people's confidential information. That's a conversation you probably want to have offline. You know, some businesses are so small or operated by families, and maybe that's going to be more of a group discussion, but you definitely want to protect confidential information. And if people bring things up at the group, you know, that might be their prerogative, but you might want to let people know, hey, this could be private information. So definitely, you know, don't share this with the group, share this with me unless, you know, you really want to. You can't always control what people decide to do. It is going to be their choice. But you can make these options available so that way you can help take care of yourself and take care of your employees. I also want to bring up a couple of last things. So the CDC has issued new guidance, and they always are, but they've issued new guidance just last week on the people who are at risk of severe COVID-19 illness. So this goes back right to our last scenario. So one thing I want to point out is we've been used to thinking about people at higher risk are people over the age of 65. But the CDC has put the kibosh on this, and they're now saying that among adults, risk increases steadily as you age, and it's not just the people over the age of 65. And one of the reasons of this is nationally, we're seeing a lot of hospitalizations of people who are even under 45. So all of the different risk factors can combine, and it's not just going to be people who are over the age of 65 who are at risk. There's a lot of people who can be at risk, and the older you are, the more at risk you're likely to be. And this information is going to be changing. We've seen situations where children have been affected by severe inflammatory illnesses because of COVID-19. So you might want to forecast that this could even change a little bit more in the future. I want to also add that previously pregnant women were not on the list. They are now, because they're having so many increased hospitalizations of pregnant women and newborns. They've also expanded the list of other illnesses. So, you've heard probably lung disease and diabetes, but now they have increased guidance on all kinds of different lung diseases. So, for example, COPD or asthma is now added to the list, just to kind of clarify things. So those are some pretty important updates I think that you should know about. I think that probably we all need to know about, whether we're business owners or not, but just something to keep in mind. Another thing to keep in mind is just because you can doesn't mean you have to. You don't have to allow people into your space. That is up to you to decide where you want to go. If you want to have outdoor things only, if you want to have delivery and online shopping only, if you want to have appointments or things like that, there's a lot of things that you can do to control your space, especially in situations where, there's people who are becoming upset or angry over, probably everything that's going on in the world, and, deciding that maybe wearing masks is where they want to make their last stand. If you have anyone, this is the same as last time, but it's worth repeating. If you have anyone show up with symptoms of COVID-19, you can absolutely send them home. You absolutely should send them home. And you should know that the CDC says you don't have to let anyone back until at least 72 hours after all their symptoms have cleared. So say, for example, you have someone, probably an employee, for example, who has a temperature, a fever. You can say that, sorry, you can't come back until at least 72 hours, until after your fever is passed. Just remember face coverings and that 6 feet of distance. If we learn more from science, that might change. For most folks, face coverings can be cloth masks. For some folks, medical grade masks. Maybe not necessarily the N95 masks, but other medical masks. OSHA can help you find those things. Also, as a business owner and as an employer, you should know the symptoms of COVID-19, so that way you can spot them. OHA and OSHA are creating signs that you can post up to help people remember these things, to know where they can go get help if they do, display some of these symptoms. And these signs are in multiple languages, which can be really helpful. But knowing these symptoms, you can't send someone home unless you know that they're just, they have some of these symptoms, for example. So knowing these symptoms can be really important. Knowing that, sometimes people are sick and they don't have any symptoms is why face coverings and masks are really important. I think education is going to be a really, really big part of our reopening stages, whether we go back or go forward. Knowing where the virus is, what we know about the virus, but also, letting people know that, if they want to support you, if you're their favorite business, their favorite restaurant, their favorite, tattoo artist, their favorite, folks that they go to every time that they move, then it's their job too, to wear their masks and be protective. So signs are really helpful for that. I've gotten emails from a lot of small businesses that I've frequented, and even some large ones I've frequented, about their rules. There's a lot of things that people are doing. I think we can do a lot to learn from each other, and hopefully I really look forward to hearing about some of the things that the folks in our audience have done to see what they can do to help open safely. So thank you so much for listening. We're going to stop recording in a few minutes, or in a minute, and we're going to open it up to questions. If you're following along on the live stream this morning on June 29th, there is going to be a Zoom link that you can click in Facebook to be able to join in on the question and answer session. But otherwise, if you have any questions of me or any questions of Livelihood Northwest, you're welcome to also reach out to us, you know, when your business isn't open and you have a little bit of downtime, whenever that might be. So thank you very much, everyone. I really appreciate this opportunity to speak with you, and I hope that you're safe and you're all taking very good care.